My name is Rose Kopsinge, a Ugandan climate justice activist. Today we're going to be discussing about climate change and public health. I think as activists, we believe that a climate emergency is a public health emergency. And that is why I have three amazing experts, Professor Mark Maslin, who is a member of the Climate Crisis Advisory Group, Professor Anthony Costello, who is a professor of international child health and the director of UCL Institute of Global Health. And we also have the brilliant Dr. Marina Romanello, who is a research fellow at the Institute of Global Health and a research director for the Lancet Countdown. I'll start with Professor Mark. How would he explain climate change? Because many activists out there are actually engaged in climate activism, but they feel like the science has been so hard for them to understand. So if you can briefly explain what climate change is, I think that will be a good start.
Thank you, Rose, and thank you for chairing this wonderful panel. Climate change is really very straightforward. Greenhouse gases in the atmosphere warm the atmosphere. So the more fossil fuels we burn, the more methane we release from agriculture, the hotter it's going to get. And that temperature change causes climate change because it moves the different climate zones around, it causes extreme weather events, it causes droughts, it causes storms, it causes floods and wildfires. And that is when it impacts directly on public health and public safety.
Thanks for breaking it down for our viewers and listeners out there. How is climate change? You've talked about the extremes, the droughts and floods, and how are those connected to public health?
So if you could imagine your own society, you know that there are sort of like weather that you can cope with. You know, you'd like summers to be a particular temperature, you have winters a certain temperature, you also have rainfall, maybe once or twice a year, you have the rainy season, you have the dry season. And because that's predictable, you can then plan your agriculture, your food production, your cities, and how you actually deal with that. The problem then is beyond that. If suddenly those climate change actually affects the extremes, when you get drier dry seasons or wetter wet seasons, or the wet season doesn't even turn up, suddenly all those predictions, all the things that you build your society on, suddenly fall down. And that's when public health is directly affected. It's when our coping zone within each society is actually breached. And the big problem is people forget that we are already in the middle of a global health crisis. Something like 7 million children die needlessly every year of preventable diseases and starvation. Something like 825 million people go to bed feeling hungry every night. And there's still 1 billion people that do not have regular, safe access to drinking water. And so we're in this health crisis now, which we could deal with because we have all the money that we need. And those people are the most vulnerable. So if you take that and then you change the climate, you make food more expensive, or you cause a drought, or you have a big storm, then what happens is that makes it all worse. And that's why climate change directly affects people's health, particularly the most vulnerable people.
What you really said is very close to my heart, especially being a Ugandan and growing up in, agro-based communities. And like where I come from, we depend on agriculture. My parents work in tea factories. So once it's just a big drought, then they're laid down from work. They're laid off from work. And that affects food security, that affects children's education, that affects every aspect of our life. And that is not one household, that is almost 80% of the population, for example, in Uganda, depends on agriculture. So thanks, Mike. And I think I'll be coming back to you. Allow me to first move to Dr. Marino.
Thank you, Rose. And just a bit to tell everyone about our report. The Lancet Countdown is an international collaboration, and we produce data and evidence to track progress on health and climate change, to track the world as it moves from through climate change action and what that means for health. And the report that we published in 2021 is the fifth iteration of these indicators and this data. And year on year, we've been warning about the risks of climate change, seeing trends get quite worrying. And our latest report shows that things are getting worse quite rapidly. The main finding and the most concerning finding is that across all of the indicators in which we track the health impacts of climate change, we're seeing things getting worse really, really rapidly. And climate change is starting to undermine the foundations of good health. Our health system is increasing the pressure on our health system. As Mark already said, we're facing health hazards, and we have big numbers of the world population that are already facing risks from climate hazards. And this is getting very rapidly worse as a result of climate change. We're seeing very fast increases in the number of people that are exposed to extreme heat, putting those very vulnerable populations, very old people, very young children at life risk because of this extreme heat exposure, with heat more intense, more frequent and longer. We're seeing that increasingly more and more percentage of the global land area is affected by drought, which not only affects our food security, but also our water security, sanitation, and access to services. And we're seeing that extreme weather events are becoming increasingly intense and frequent. For example, we're seeing wildfires affecting more and more of the land population as well, and particularly determined by climate change. So across all of the dimensions for which we're tracking the health impacts of climate change, we see that things are getting very rapidly worse. And these are, as a cascading effect, these health impacts are one on top of the other. As Mark said, we're in the middle of a health crisis determined by COVID, which limits our capacity to access health services. And on top of that, you have these extreme events also putting people's health at risk and undermining their capacity to access care.
And I think the other aspect of public health that we need to bring to face is the mental health and anxiety that we are facing as activists and other people that are highly affected. My next question would be, how can we ensure that more professionals, leaders and other people, corporations and private sector and public sector come together to actually treat climate change, treat the climate emergency as an emergency that it is?
From the health perspective, obviously the involvement of the health community in the discussion of climate change is essential. And it's essential not only because health is being threatened by climate change, and climate change will determine the health profile of present and future populations down the path that we're currently going, but also because the way that we respond to climate change can deliver enormous benefits to health. Most of the interventions that we need in order to deliver climate action go side by side and very aligned with very reasonable, very sensible public health interventions. For example, making cities more livable, increasing our capacity to move by active travel, making cities safer, reducing our consumption of red meat, which is hazardous to health, decreasing air pollution, decreasing the burning of fossil fuels that also directly damages our health through fossil fuels, as well as by the climate crisis. So getting the health professionals into that conversation in order to ensure that we're not only avoiding the increased health impacts of climate change and that we're protecting vulnerable populations from the health of climate change, but also in being able to deliver climate action that maximizes the health benefits from that kind of redesign of the way that we live, particularly in urban centers, in a way that is healthier, is absolutely essential. And we have good models that establish how much we can save in terms of burden of disease, of premature mortality, if we were to align the response to climate change to public health interventions. So the involvement of the health community is absolutely essential. By and large, we're seeing that, and over the years, the health community has become much more active in the climate change conversation. But in general, what we do see is that discussions around climate change adaptation, climate change mitigation, not always involve the health professionals, and that enabling that conversation and involving health professionals in able to drive climate action and truly be able to protect our health in the climate crisis is absolutely fundamental to ensure that we're delivering a healthy future for present and future generations as well. As a core of that, what we're trying to do from the Lancet Countdown is put the evidence out there, quantify and put in kind of scientific terms and in very tangible numbers what is the health impact of climate change and what would the benefits look like if we were to accelerate climate action, and also involve the health professionals through our outreach, through kind of our writing policy brief, policy engagements, in ensuring that they are involved in that conversation and they become very deeply involved, because this is very much a public health crisis.
How is it possible to actually lobby for finance to, how can we lobby for finance to finance or fund public health and climate adaptation and mitigation?
That's a very interesting topic. And I would say that although it's true that the explicit mention, you don't have a section on health explicitly in the COP negotiations, health was very much present across most of the discussions. And that has been quite encouraging, as opposed to what has been happening in previous negotiations, where health wasn't as present. So that marks a bit of a shift that the WHO has been promoting as well, and they have been doing lots of leadership in getting health into the center of the conversation. I think we have to acknowledge that some small progress has been made, but as you said, it's really not enough. And one of the interesting things is that when we think about financing for public health starts from people's homes, starts from cities. So when we think about public health, we really have to think about adaptation from the whole of the urban and the social matrix to promote healthier lifestyles and to promote healthy adaptation and mitigation. So while it's not explicitly directed at climate change, I think we need to advocate against that divide of one thing being funding for public health and another thing being funding for climate action, because they very much are the same thing. So in all of the unrolling of climate finance, we have to keep health and well-being at the center of those plans, ensuring that when we're redesigning cities, when we design our buildings, when we redesign our energy systems, they are keeping in mind how we interact with them and what a healthy urban matrix or rural matrix looks like in a kind of 1.5 degree world. So it's very much about incorporating and integrating the public health discussion into everything else, rather than having it as a self-standing element, because we cannot have public health without healthy cities, healthy lives, healthy homes for people.
Amazing. Thank you so much, Dr. Marina. Women and children are particularly more vulnerable to climate change, and more so health difficulties. What can be done to protect them from this public health emergency?
Thanks, Rose. And you're absolutely right that women and children are always, in a sense, one of the most vulnerable parts of population for all kinds of reasons, because of discrimination, because of economics, because of access. And it's certainly true that the poorer people are and the more deprived they are, the much worse their indicators of health, like infection, like nutrition, like childbirth problems, goes up. So we're well aware of that, and you'll be aware of that from your own experience in Uganda. So the question then is, how do we protect women and children generally? And then what additional things can we do about climate change? So I think the first thing I would say is engaging with communities. I've spent 25 years working on how you engage through, for example, women's groups. And we've shown that if you work with women's groups repeatedly, they can solve many of their problems in terms of reducing their newborn death rates, improving their nutrition, and indeed, community groups can also tackle risk factors like for diabetes and the like. We've shown this in studies in Bangladesh, and of course, mental health as well. So engagement is very important. It's something that the medical community often forget. In my country, loneliness is a huge problem across the age spectrum, particularly in the elderly, and we do virtually nothing for it from the health sector. And so these are issues that go beyond the primary healthcare sector. But then, of course, you've got other issues like economics. You can't expect poor women in subsistence economies who are seeing their environment being degraded, are finding it more difficult to get crops from their land, all the problems that are associated with heat stress, with infection risk, they need to be protected by their governments, and their governments also need to be protected as a result of environmental regulation. You're from Uganda. I've worked in Malawi. Those countries have not materially contributed to the greenhouse gas pollution that Mark was talking about, the cause of the problem. My country has been emitting greenhouse gas emissions from fossil fuels for the last 180 years. So we have built up our economies on the back of pollution that's now affecting Uganda, Malawi, South Asia and the like. So there is a real justice issue here. And you mentioned finance. I mean, back in 2015, wealthy countries committed to provide $100 billion a year, which sounds like a lot of money, but when it's spread around the world, is not a lot. And even now in 2021 at the last COP, they still didn't reach that figure, despite the fact that we've spent a fortune on the pandemic. So these are really big issues. Making sure that people have a living wage, that they have access to jobs, and that you have environmental regulation that's going to affect the world. And nothing could show this more than the pandemic. I mean, the pandemic is linked to climate change. If you degrade forests, push humans closer to wildlife, you're going to get viral spillover. You're going to get viruses jumping from wild animals to man. And the SARS, the Ebolas, HIV, there are so many examples of where that's happened. And we have to try and do something about that. Now, the pandemic has had huge attention, trillions of dollars thrown at it, often because we didn't take the right public health action at the very beginning. Some countries did in East Asia, and they've suppressed that epidemic before they get vaccinated. We didn't manage to do that. But, if I send out a tweet on social media about the pandemic, I'll get hundreds of retweets. If I do it about the silent emergency of climate change, I'll get 5. And, there isn't the same awareness. The pandemic is an immediate problem. Am I going to catch COVID? Do I need a vaccine? But climate change, which is actually, I'm sure Mark would agree, a much worse problem for women and children, we don't have that kind of sense of urgency and of action. And there's lots of activists like yourself, like Vanessa, like Mark and others who are trying to get that attention. But politicians have a very short attention span. They're thinking about the next election the whole time. And somehow we've got to get across the urgency of the situation, because so far we've done very badly in preventing the effects on women and children.
Well, thank you, Professor Anthony. What is it that can be done to actually keep below 1.5?
Intellectually, I'm sure Mark and I would agree that it's easy to be pessimistic about what's going on with climate, that it seems very likely that within a decade, we will be reaching 1.5 degrees globally. Mark will know more about this than me, and that it will probably be reaching 2 degrees within 20 to 30 years.
Wow.
So we don't have a lot of time. The only optimistic aspects of it from COP is that I got the impression there that for the first time, major corporates are beginning to realize that we have to change, because it's going to affect the whole economic ecology, if you like. And that's what they're interested in. They want markets, they want profit, shareholders, and all the rest of it. But they're realizing that that's going to fall apart quite quickly if things don't happen towards renewables, towards better land use, and all the other things we need to do. So I think there is a move from the private sector, the financial sector, the corporates, whether it's quick enough, I'm not sure about that. And they will put pressure on politicians as well as voters themselves. Because although I've said it's more of a silent emergency, I think people around the world really are getting it now. In the last 2 or 3 years, the droughts, wildfires that we've seen in the southern and western United States, in Canada, in southern Europe, drought, northern Europe, floods, across Africa, across South Asia, across East Asia, wildfires in Australia. Every part of the world is being affected by this. And I think, your parents, friends of mine in Malawi, in Nepal, the landslides, as you've said, these are issues that are really beginning to bite home. And so I think there will be upward pressure from both the electorate and also from, corporates. Whether that's going to be enough is another issue, but it means that if we retain some optimism of the will, we have to make sure our voices are heard. And that's why it's so encouraging to see younger generations really leading, actually spearheading the concerns about the future. My generation has failed. I'll be very open. I mean, we've been talking about it. Well, I've been talking about it for 15 years, Mark for longer than that. But we have failed, and a lot of my generation still want to put their head in the sands. But for your generation, Rose, everything that you do should be pleading this. And it's not just for the health component. We have to have health in all policies. Health arises from the finance ministry, better housing, better environmental regulation, air pollution, social services, et cetera, et cetera. And all of that contributes to healthy populations.
Wow, thank you so much, Professor Anthony. And I think I'll first go back to Mark because we're almost soon closing. So the leaders think that climate action is very expensive, but for us, we believe inaction is far more expensive.
Well, Rose, this is something that deeply frustrates me and all the activists in the world, because what we know is that if we actually decarbonize, we actually make people healthier, safer, happier, and usually wealthier. And so it's really frustrating when you're dealing with politicians to say, look, all of the win-win things that can happen if you decarbonize. I mean, let's start with the mega finance, okay? The economists, and these are hard-nosed economists, okay? They just care about the dollars, okay? They say if we don't deal with climate change, by 2050, it will cost us 20% of world GDP, which will be a huge amount of money. If we deal with it now, the infrastructure costs will cost us about 1% of world GDP to shift to renewable and sustainable farming. Tick. If you then look at, say, the Downdraw project, they turn around and say, well, yes, but all those incredible co-benefits from having healthier people, having less healthcare costs and all of that, add that all together, and that would actually save us $46 trillion, which is about half the world GDP at this moment in time. And there are so many positive health benefits. I mean, the first one, if we go to a more plant-based diet, okay, around the world, you suddenly get rid of obesity, which is causing massive problems, health problems in the developed world and also parts of the developing world. We also then reduce the amount of sort of like the cancers, the strokes, the heart attacks. We actually allow people to live longer and healthier lives. The interesting thing, which people forget until the economists do the calculation, is, of course, one of the biggest costs in most countries is healthcare. Okay, in the UK, it's something like 11 or 12% of our GDP. In the USA, it's up to 17 or 18% of their GDP. So if you save money by people being healthier, not needing all those drugs, not needing to go to hospital as much, and living longer, you make a huge saving for the country. And that's just looking at across the board. If you then look at people moving from sort of like using the car to public transport, to cycling, to walking more, you suddenly become much healthier. I've always been inspired by Anthony, because Anthony made that shift to the bike very early on and said, look, I'm getting slightly older and I'm going to have to make sure I keep as fit as long as possible to keep the good fight going about climate change. And so, again, all these co-benefits. Also, if we improve our agriculture, if we improve the actual quality of food, that's going to improve everybody's lives. And actually, I think the big one where people really do worry is extreme climate events. The droughts, the floods, the heat waves, the actual storms, the wildfires. Those are things that directly affect people's health, but they also have a long-term effect on people's health, whether it a huge reduction in nutrition, whether it happens to be sort of like air pollution from wildfires, or the one thing that always gets forgotten is the mental health impact of these crises. I mean, if you've gone through one of those crises and you've lost family members, you've lost your community, and you've had to rebuild, the long-term effect on your mental health is huge. So the actual bonuses for actually dealing with climate change are huge. And I have to say, I'm going to agree with Anthony. The one thing that gives me hope is activists like you, Rose, because when I was in Glasgow, the Friday huge demonstration of young people saying, enough is enough. You old people have failed. You need to save our planet for ourselves and for nature. Please do it. And then on Saturday, I thought, can't get any bigger than the sort of like the Friday strike. Oh no, the whole of Glasgow came to a standstill because everybody came onto the street. You had people who were in their 80s with a walking stick. You had young families with their babies, with their young children on the streets protesting, saying, world leaders, you need to take this serious. And I think that's the thing that Anthony and I see that's different now than 10 years ago, is the new generation has suddenly stood up and gone, this is the time you have to start to change. And it's people like you, Rose, out there that actually are driving people to realize how important it is, how closely it is linked to their own health, their own security, their own safety, and also their future and their kids' future. So that is, I think, the biggest message, which is the new generation is coming out fighting, and we're there to support you.
It's been amazing to speak about all these issues, especially with us activists that place the vulnerable communities, come from vulnerable communities, and are fighting for a safe climate and a safe planet Earth, because we know there's no planet B. So when we discuss these issues and hear people like you driving ambition, acting in your own capacities, I think it also gives us hope. So I think the last question, really, having said that, is what are you committing? What new commitment are you making today regarding driving climate awareness, driving leaders to act, and in general, climate action and protecting the vulnerable communities?
I think what's been really important is working with different people from different organizations. So I've been incredibly fortunate. I've worked with incredible medics like Anthony. I've worked with engineers. I've worked with lawyers. I've worked with historians, all focused on the environment and the climate crisis that we're facing. And I think collectively, academia and that wisdom and research really provides us with that basis of understanding that we can then start to move forward. So it gives us a way of actually helping young people, activists, and people who are trying to drive change to say, these are the drivers. These are the best way of actually helping into the future. I'm also going to carry on communicating, talking to anybody and everybody, because I'm firmly of the belief that if we talk about the greatest threat to face humanity, things change. It starts with a conversation. So suddenly, two people, could be middle managers, suddenly start to talk, and somebody actually opens up about their climate anxiety, and they go, look, I'm really worried about this, I'm losing sleep. And the other person goes, oh, so am I. And suddenly, they start to actually come together, and they spread across the company. And suddenly the company goes from being zeros to heroes and becoming sustainable, looking at their carbon footprint, in supporting their employees, in actually how they actually work. And that's really important. I think this is something, Anthony mentioned this. We worry and talk about the pandemic, but we don't talk about climate change enough. And so for you, you and other activists around the world, if you can raise awareness, so people in weird positions, whether it happens to be accountants, lawyers, happens to be people making t-shirts, if they start to talk to each other and they worry about it, and they suddenly realize that it's much easier to be sustainable, much easier to look after their carbon footprint, and interestingly enough, it usually makes a bigger profit. And so therefore, I think there's lots of these discussions that we have to have. So my one piece of advice, and I'm going to drive home and I'm going to talk to as many people, is talk about climate change, because collectively we can deal with it and start to make huge changes.
You know, I'm working with two main programs. One is called Children in All Policies 2030, which we only set up less than a year ago. And this is working with WHO and UNICEF and a whole number of countries to think about ways we can work not just in a Ministry of Health, but across sectors to look at ways in which we can improve. To give one example, we're trying to set up a program at scale where you work with young people who act as what we call citizen scientists. So young people are given mobiles and programs where they collect information about their own environment, their village, their suburban area or whatever. And then that is pulled together, and then they come together with teachers, community leaders and the like to think about ways in which they can take action to protect their community more effectively, the water supplies, the nutrition, the landslide protection, etc. So that's one thing that we're doing. Another area is on heat stress and looking at solutions. As you say, we need actions, not just, you know, research. And the sort of solutions that communities can come up with to deal with times when things are very hot. How can they protect women working in fields? Are there times of day that they should be protected? Are there other things that we can do to do that? And again, that involves engagement, not only with communities, but also with local policymakers. Then I think more generally, we need to think much more about working with particularly young people on the health benefits of being nature aware. I mean, you know, I was brought up in London and I went to school and I never did a single lesson on horticulture or, you know, environmental stuff. I think that is changing, and we need to make people much more aware of how important our environment is in cities, in countryside, in rich countries and in poor countries. And then finally, I think we hope, you know, we're working with economists as well. Ultimately, we have to put a proper price on carbon pollution, and that means carbon taxes. It doesn't mean that we just increase all taxes. We can slash income taxes and improve the tax that we put on carbon so that there is a real incentive for people to shift from high carbon fuels to zero carbon renewables. And I think that's something, again, that we need to campaign in the northern countries to ensure that they recognize the importance of decarbonisation, which is going to be essential, and it's going to change the way we live. So I think there's lots of things we can all get involved with. And I think we should stay optimistic. You know, I mean, humanity has been through shifts in climate change for many, many millennia. And this is going to be tricky, but we are a clever, resilient species. So I think the future for you guys is good, actually, as long as we really take this seriously. And having a big challenge to tackle is also quite motivating.
Just one thing I would like to task all of you to do is that in all the conversations and actions that you are doing at individual level, organizational level, any level, include the aspect of justice and fighting inequality, because inequality is the major drive that is really exposing the vulnerable communities to these harsh climate realities.